Hello everyone. Hope you are safe at home. Today we are going to discuss about introduction to psychiatric nursing. So first, let's start with introduction. A specialty nursing practice focusing on the identification of mental health issues, prevention of mental health problems, and the care and treatment of persons with psychiatric disorder. This definition is given by the American Psychiatric Nurses Association. It means it is specially focusing on identification of mental health issues and its prevention of mental health problems, and it is also provide a care and treatment of a person who is suffering with psychiatric disorder. The scope of psychiatric nurse may be in general psychiatric care and specialized area like child, adolescent mental health nursing, geriatric nursing, and forensic and substance use. So these are the fields where a psychiatric nurse can work. Let's see the history of psychiatric nursing. In the 1840s, Florence Nightingale made an attempt to meet the needs of psychiatric patients with proper hygiene, better food and light and ventilation, and the use of drugs to chemically restrain violent and aggressive patients. Linda Richards, the first psychiatric nurse, graduated in the United States in 1882 from Boston City College. In 1930, Johns Hopkins University was the first college of nursing in the United States to offer psychiatric nursing as a part of its general curriculum. The first psychiatric nursing textbook, Nursing Mental Disease, was authored by Harriet Bailey in 1920. The registration of psychiatric nurse was done by 1920 in the UK, and degree course in the psychiatric nursing begins in the USA. Psychiatric nursing was included in the basic nursing curriculum by the International Council of Nurses in 1961. In 1963, President John F. Kennedy in the United States passed the Community Mental Health Act, which proposed the deinstitutionalization of mentally ill persons. In 4th century, during the period of empowered Ashoka, hospitals with 15 beds for mentally ill with 2 male and 2 female nurses. In 1964 to 65, psychiatric nursing was included in the curriculum. For the first time in India, 11 British nurses along with the 1 matron were brought from the UK to work in the mental hospital at Ranchi in 1930s. Short training courses of 3 to 6 months were conducted in Ranchi in 1921, which were recognized by the Royal Medical Psychological Association. During 1948-50, 4 nurses were sent to UK by Government of India for mental health nursing diploma. From 1943, Chennai government organized a 3-month psychiatric nursing course for male nursing students at the Mental Hospital, Chennai. During 1954, Manzil Medical Health Center, Lucknow, gave psychiatric nursing orientation course of 4 to 6 weeks duration. In the continuation of history, Government of India decided to start training psychiatric nurses during 1953 to 54 and started the first organized course at All India Institute of Mental Health, which is presently called as NIMHANS. In 1964 to 65, the Indian Nursing Council made it a requirement to integrate psychiatric nursing in the nursing diploma and degree courses. In 1967, a separate psychiatric nursing committee was formed in the Trained Nurses Association of India. Diploma in Psychiatric Nursing is conducted in the 3 institutions in India, and Master of Psychiatric Nursing program is conducted in many institutions. So this was the history about psychiatric nursing in India. Now let's see the principles of psychiatric nursing. The first principle, we already learned about principle in previous class. So these are the few points you need to remember. So the first point is allow client opportunity to set own pace in working with problems. Nursing intervention should center on the client as a person, not on a control of the symptoms. Symptoms are important, but not as important as the person having them. Recognize your own feeling toward client and deal with them. Go to the client who needs help the most. Not allow a situation to develop or continue in which a client becomes the focus of attention in a negative manner. If client behavior is desired, base your decision to intervene on whether the client is angering himself or others. Ask for help. Do not try to be a hero when dealing with a client who is out of control. Avoid highly competitive activities, that is having one winner and a room full of losers. Make frequent contact with clients. It lets them know they are worth your time and effort. Remember to assess the physical needs of your client. Have patients move at the client's pace and ability. Suggesting, requesting, or asking works better than commanding. Therapeutic thinking is not thinking about or for, but with the client. Be honest so the client can rely on you. Make reality interesting enough that the client prefers it to his or her fantasy. Compliment, reassure, and model appropriate behavior. So this was the principle. Now let's see what are theories we can apply in psychiatric nursing. So psychiatric nursing uses theory of human behavior as its scientific framework and requires the use of the self as its art or expressions in nursing practice. So here are some theories. The first one is Pavlov theory, theory of interpersonal relationships, psychoanalytic theory, behaviorism, Jean Piaget, theory of cognitive stage of development, humanistic theory, Abraham Maslow theory, Carl Rogers, existential theory, Tidal model by Dr. Phil Barker and Poppy Buckman Barker. So these were the theories which we apply in psychiatric nursing. Next is role of psychiatric nursing. What a nurse can do in psychiatric field. So providing a safe therapeutic milieu, which is milieu is called environment as well. So providing a safe therapeutic environment, working with patient or client on the real day-to-day problems they face, identifying and caring for the physical aspects of the patient's problem, assuming the role of social agent or parent for the patient in various recreational, occupational and social situations, conducting psychotherapy, providing leadership and clinical assistance for other nurse and healthcare workers. So these are a few psychiatric association, nursing association, International Society of Psychiatric Mental Health Nurses, Indian Society of Psychiatric Nurses, Association of Child and Adolescent Psychiatric Nursing, and Registered Psychiatric Nurses Association of Mental Health Laws, In India, the Mental Health Act, Mental Health Law in England, Wales, including Mental Health Act 1983, Saraswat V. Regent of the University of California, and McLean rules. Thank you. These were about the psychiatry nursing in India.